All right, we're going to kick off session number 2 of our afternoon breakout sessions. It's my pleasure to introduce our 2 panelists today. So Ronald Mcfarlane is an advocate for healthy environments and sustainability with experience in Africa, Asia, and Canada. His recent work includes a review of health co-benefits of climate action and the impacts of climate change on health, as well as the impact on unconventional gas development. And Ronald has spoken at numerous community forums, national and international conferences, as well as UN meetings. And Carol, as a manager at Toronto Public Health, Carol has developed healthy policies, including pesticide bylaws, active transportation, air quality, and climate change. Carol is a citizen member of the Durham Region Roundtable on Climate Change, as well as the Ontario Public Health Association's Environmental Working Group. And as well, much like Ronald, Carol also has a multitude of speaking experience provincially, nationally, and internationally. So I think, Ronald, you're kicking this off, so I'm going to turn it over to you.
Okay, thank you very much. I was invited to talk a bit about how we can promote climate action. And I think one of the things that is important is to recognize that there are people who are not completely convinced that climate change is important, or if it's important, they're not quite convinced of what needs to be done. And I think part of the way we can mobilize action is how we frame climate change. And one of the ways to do this is to make sure that it's very personal, so that people feel that climate change impacts them, impacts their family, impacts their community. And health is one way to for people to make that connection between climate change impacts in themselves and their family. So framing climate change action within a health frame helps encourage people to support action at a local, provincial, or national level to mitigate and adapt to climate change. Climate change impacts are direct and indirect, and the direct impacts would be the heat-related impacts, the actual impacts of actual flooding, such as drowning, as well as mental health impacts of severe weather events. The indirect impacts are impacts that occur because of the impacts on the ecosystem that then rebound in terms of health. So impacts on agriculture, and therefore impacts on food access, air pollution from forest fires, and the spread of vector-borne diseases are sort of all impacts that are secondary in terms of climate change. And the one thing as well that is important that I'm going to focus on this in this presentation is on the additional health benefits of doing climate actions. So when you're doing climate actions, you're addressing the direct impacts and some of the indirect impacts, but these actions can also have some more immediate benefits to health. And those are the ones that people can probably grab onto, and it encourages them to take action because the benefits are very clear to them. Now, a still controversial issue in many parts of Canada is this whole idea of putting a price on carbon. Nobody likes carbon taxes, and nobody likes taxes to go up. However, it is probably a key policy objective that is needed if we want to move on climate. So putting a price on carbon sort of provides a way to collect revenue that can actually then help the economy, help the country shift the economy to a more sustainable economy, and therefore can help so putting a price of carbon you can use that to help you move to the low carbon economy. And people will have often argued that carbon pricing is a drag on the economy. That all the studies that have looked at it have not shown it to be so. So it is so it's a way of saying, well, yeah, you are concerned about that, but the experience is it's not there, because even, for example, Sweden, which has probably the highest carbon tax, and it's around 200 Canadian dollars, or even more than that now, per ton of CO2, is actually, the economy there is flourishing. So in spite of its very high carbon tax compared to other countries, there has not been an economic downside to it. And the other aspect that is often brought up as against the carbon tax is potential equity concerns. And it is true that if you tax carbon and therefore fuel prices go up, people on lower incomes spend a larger portion of their income on energy. But again, it's a matter of then putting in programs that will counteract that impact. So it's possible to address these concerns. One of the clearest benefit of climate action, and the one that there's more known about and been better quantified, has been the health benefits from improved air quality. You stop burning fossil fuels, you stop emitting pollutants in the air, so the air quality improves. And it improves overall, and as well as improves for people who are living close to major thoroughfares. So what we have found, for example, I mean, has not, in Canada, we have yet to actually estimate the costs of these improvements for health, although I do know there are plans to do so. But a recent study that was published in the US in terms of the Eastern Seaboard has shown that, in fact, the actions they have taken in the last few years have actually resulted in more than 11 billion savings in health costs. So clear savings and some of that, of course, covers the cost of doing these actions. The other thing as well, which is related, another pollutant, which people don't talk so much about because it doesn't have a direct health impact, is methane. Methane is actually a very strong greenhouse gas. It has 84 times the potential of warming potential in carbon dioxide on a 20-year average. And it contributes to ground level ozone, which has adverse health impacts, as well as the impacts on agriculture and plants, because ozone is very toxic to plants. And you actually see reductions in yields because of high ozone. So you would have that additional benefit of air benefit from doing this. In terms of our communities, a lot of climate action involves improving the design of the community so that it is more walkable and more easy to cycle in. The main benefit of doing that is increased physical activity, and also improved sense of well-being, just because you have sort of what ends up being a more vibrant community in which you can live. Therefore, policies that try to encourage development in existing town areas as opposed to sprawl will have these kinds of additional health benefits. So overall in transportation, you have the, if you put in cycle paths and other ways to move around, you improve air quality and you improve and you improve the opportunity for active transportation. You end up with a host of benefits. So you have reduced exposure to traffic-related pollutants, as I mentioned, reduced crop damage and less extreme weather, reduced noise, fewer vehicle-related injuries, increased physical activity, and actually greater equity in a less car-dependent transportation system because you have better, cheaper options more easily available to move around. So in terms of transportation action, the greatest benefits are actually related to the physical activity that we expect would occur when more people move around using active transport as opposed to cars. Also, talk about impact of methane and ozone on food production in terms of reducing greenhouse gas emissions. Agriculture produces a fair amount of methane, and that is actually one of the areas where switching your diet to reduce the amount of meat you eat would have an impact on greenhouse gas emissions, methane in particular. And reducing waste, because food waste will, when it decomposes, creates methane. So based on that, we have shown that shifting to a low meat diet could have an important reduction, as 40 to 50% reduction in greenhouse gases from the food sector, from the agricultural sector. And in Canada, most people eat more meat than they need to, and therefore, in fact, shifting to a low meat diet would improve their health. If we look at our overall energy system, it has been suggested that Canada could move to 100% sort of green energy by 2050, and some would say even earlier than that. And it has been estimated that we could reduce mortality about close to 10,000 per year in Canada, and at a savings of $110 million a year. So again, important health benefits from shifting our energy system to being all low carbon. Energy retrofits, of course, it's important to reduce demand on energy for two reasons. One, while we're using fossil fuels, that means we'll need fewer of them to keep ourselves warm. But at the same time, if we have more efficient housing, it means we need less energy, and therefore it actually makes the transition to a low carbon easier, because you don't have to create as much energy to maintain your buildings warm or cool. And energy efficiency has been, and retrofits have been linked to improved health among people who live in these dwellings. And I think I'm getting close to the end of my slides. Green space. Green space has umpteen benefits to health, both physical and mental health. And green space can help sequester carbons, and their cooling effects reduce energy demand. So again, maintaining and improving green space, which are important in terms of both mitigating climate change, but mostly as well adapting to extreme weather and improving the adaptability of your communities to extreme weather, has these additional health benefits. So I've talked mostly about all the good things about climate action. I do think we do have to also acknowledge that sometimes some of the actions are not perfect. And so we need to recognize these, because oftentimes that's what happens. People will argue about, well, but it's not perfect. So there are low carbon fuels. Biofuels have been talked about, and there's a lot of debate about how green they are, but we have air pollution that comes from biofuels. Methane emissions from large hydro dams, especially when they are first created. And we have toxic materials in batteries and electric vehicles, and we have toxic materials in solar panels. So we need to acknowledge that they're there and say, well, we are aware of doing it. And the other aspect that is always a problem at the beginning of the curve is affordability of all this new technology. It often is more, so therefore we need to address these issues as we move to low carbon fuels. Low emissions vehicles are only low emission if your electricity is low carbon. In a lot of the country, this is the case, but in places like Alberta, it's not so much the case, because electricity is still fossil fuel based in Alberta primarily. And the other aspect is, if you focus just on replacing vehicles, and as opposed to increasing active transportation, you miss out on the physical activity benefits of climate action. And as I mentioned earlier, with transportation, most of the health benefits comes from shifting from car dependency to active transportation. Energy retrofits, part of the challenge is that these increase property values and therefore can impact people on lower income. And if not done well, you can have sick building syndrome in terms of not clearing air pollution, maintaining the air quality inside. Again, with community design, you're having more people in smaller areas, so if not designed properly, you can end up with having some aspects that are less desirable. And we need to recognize that the transition will have impact on farmers and people involved in the energy field, and it's going to be difficult for them. So therefore, providing supports for them in the transition is a way of encouraging them to support these actions. And is it possible to do it all? And I mean, we are told that we have to cut emissions by 50% by 2030, which is just less than 10 years away from now. Well, many of you probably have seen these two pictures, and the one on the left is spot the motor car, and there is one. And on the other one is spot the horse, and there's only one. And this is a change that occurred in about 13 years. So it is possible to have a huge transition in our economy and the way we do things if we put our minds to it. And I think this is just my acknowledgements for my pictures. And thank you very much.
Thank you very much, Ronald. So I guess I'll turn it right over to you, Carol, if you want to pull your slides up. We have about 20 minutes, give or take, left in this session.
Okay, Ronald has to close his slide presentation first.
Yeah, if you just want to stop sharing your screen, there we go. We can see your screen, Carol.
Yay! Okay, so Ronald painted a lovely picture of the health benefits of taking climate action. My presentation is going to focus more on what actions local communities are taking. The information that I'm presenting comes from a module that I created for the Canadian, I always have to look this up, Canadian Association of Physicians for the Environment, or CAPE. They produced a climate change toolkit for health professionals. And it provides an overview of a whole lot of things. But the module that I created was really looking at actions that local communities are taking to adapt to climate change. So what my research found is that there's really good promising news. Many actions are being taken by governments, communities, and many sectors, including community organizations, groups, and individuals. And it sounds very similar to what's happening in Grey Bruce from what I've heard this morning. So my presentation is going to focus on some actions to address extreme heat, extreme cold, flooding, water quality, wildfires, food systems insecurity, and vector-borne diseases. Sounds like a lot, but really what I'm doing is just giving an overview of the types of policies and programs and providing a couple of examples that I learned about through the research. So let's start off with extreme heat. As we know, the number of extreme heat days is expected to increase significantly in the future. And as a result, there will be many, many more people experiencing heat-related illnesses. So actions that I've found consistently across Canada are promotion of heat warnings. These heat warnings are issued by Environment Canada primarily. And one of the messages is to look for air-conditioned spaces. So some local communities, the government buildings are being used as local cooling spaces. So whether or not it's a library or a community center, they provide air-conditioned spaces that people can go to if they're places that they are doesn't provide air-conditioned spaces. Other things that people are doing is in communities such as Ajax in Toronto, there's bylaws for rental units that set the indoor maximum temperatures to 26 degrees for those buildings that already have air conditioning. So they're not allowed to go above that. Toronto and the region of Durham are actually looking to go a little bit further to look at bylaws for these multi-residential rental units without air conditioning to see if there's a way that they can also attain indoor maximum temperatures. And part of what they're also exploring is looking for regulations for common spaces to be cooled, like lobbies, or creation of outdoor cooling places that provide shade. Other ways to reduce the impacts of heat is to look at increasing green spaces that Ronald talked about. And as we know, in an urban environment, especially with roads, all the black roofs, it gets really, really hot. So it's really important to increase green spaces. And communities such as Kingston and Peel region have looked at development of street tree management plans. And these plans include the need to plant more shade trees. A unique program that I found in Paris, France was the Schoolyard Oasis project. It transformed a schoolyard from asphalt into green space that the community used as a cultural hub after school. And they found not only was it providing a cooling atmosphere, but it also decreased isolation in the community, which is really important for just community resilience and community cohesion. Another way that communities are decreasing heat is to look at green roof bylaws. City of Toronto is encouraging rooftop green roofs through legislation that requires large buildings to build green or cool roofs into their building plans. So moving to the other temperature is extreme cold. That winter is expected to really bring volatile swings in temperature, that there's going to be more frequent and extreme cold spells, which doesn't sound good as we move into the winter. Most communities are issuing extreme cold warnings to provide education about the risks, especially to vulnerable populations that are seniors, those people that have cardiovascular disease, and especially those who are underhoused and are on the street. Some communities issue these warnings and focus those warnings on service providers that deal with these vulnerable populations. So, for instance, transit authorities. Transit authorities in Montreal have permit the homeless population to go into their stations to get warm. And then once the stations are closed, they provide shuttles to shelters for these people that really need to get warm. The heat warnings, the alerts trigger actions such as adding more beds to shelters or to open other warming centers. Toronto's extreme cold response includes a 24-hour respite drop-in center. So the drop-in center provides not only warmth for people that need it, but it also provides an opportunity to link these people to other services such as housing and health services. Flooding. Well, this morning we heard a lot about flooding from our keynote speaker, Blair Feldman from the Intact Center, and he provided information on most of these bullet points. So it was nice to hear that. What I heard from the community is what is actually being underway by the Intact Center. There is a lot of community action being done for places that are on flood-prone areas. For instance, policies in Alberta prohibit future development in these flood-prone areas. And for residents that choose to stay in these areas, they opt to, they'll take on future risk if they decide to stay there. Communities are also taking proactive maintenance on making sure that their flood control structures are good and looking at regrading of lots and roadways. There's a lot of communities that provide flood forecasting and warning protocols. Actually, through my research, I signed up for a flood warning notification, which I didn't know existed for public notifications. So there's a lot of information out there that people can access. And as Blair mentioned this morning, public education and outreach about the local flooding risks and the associated health impacts are really important. That outreach, an example of this outreach was done in Nova Scotia. They, based on their flood maps, they brought people together, local fire, medical, emergency response, and the public were involved. They looked at the flood maps. They talked about the types of actions that they should be taken in their community and really developed a plan for what would happen if a flood happened in their area. And they also talked about preventative actions. So the bringing together of people to discuss the local flooding risks in their communities really seemed to make a big difference in this community. So water quality. Climate change is expected to result in changes to the availability and quality of water. Extreme rainfall increases the chance of flooding, which can affect beach and drinking water quality. And storm management plans really help to reduce runoff. These plans include the use of natural infrastructure, such as rain gardens, green roofs, and trees. And they also look at improving the design of paved surfaces, such as parking lots. When you have a lot of paved surfaces, the water can't seep in. So it's important to really look at overall plans to think about ways to reduce this runoff. There's also communities are taking action through public education and outreach about stormwater and the impacts on drinking water quality. An example of this is a case study that I found from the city of Toronto, not city of Toronto, Toronto based, so that keeps coming up, is city of Barrie. They hosted a workshop for real estate agents, home inspectors, and plumbers to promote their Disconnect to Protect rebate program, which is a removal of downspouts and some pumps that were connected illegally to the sanitary system. The workshop built partnerships, and the hope is that these people would then communicate to their clients about the program, increase the uptake of the Disconnect program, and ultimately improve drinking water quality. People from the presentations this morning, they're also quite concerned about wildfires, and communities are taking action to provide education and outreach about both the direct injury from fire and the associated health impacts that come from smoke, and as Ronald talked about, air pollution. And there's lots of stress related to both the event, the stress of evacuation, and also there's stress about safely returning to their homes. So a case study that I found was in Alberta. Alberta Health Services provides education to the community who are returning to their homes after being evacuated. This included guidance on testing water quality, because they would have to make sure that their water was safe upon returning to their homes. It included awareness about air quality advisories, so they would be able to check how the air quality was in their local neighborhood. And they also provided information about possible mental health impacts about the evacuation and just the whole event, and link them to resources that were available in their community for mental health. Preventative actions are also being taken for related to wildfires. In Kamloops, BC, they have the requirement through their wildfire protection plans that requires mitigation measures be included in development plans. This might include the requirement for fire-resistant roofing materials as they're building the homes. So food systems can be impacted by climate change and related weather events such as flooding, drought, and heat. Some communities are advocating for the integration of food systems into their emergency plans. These plans would address food safety that often occur with extreme weather events that cause power outages. If your fridge is out, you're going to have problems with your food safety if it's off for a long time. So these plans would look at food safety. They'd also look at the availability and distribution of food, especially in vulnerable communities. So the emergency plans are really important to look at taking food system into the plans. Other communities are looking at the development of food action plans, and it sounded from one of the other speakers this morning that Gray Bruce is looking at food action plans or has one. These plans are designed to better understand the impact of climate change on food systems in particular communities. Toronto and Metro Vancouver have developed plans. The plans may include such things as the development of community gardens and looking at the development of zoning bylaws to expand support for local food, urban gardening. So lots of ways to think about climate change related to food systems and security. Public health and their government partners are taking action on vector-borne diseases, that's especially associated with climate change. Public health have surveillance programs, which include collecting exposure data, and then identifying effective public health interventions. And these interventions often include prevention programs. They're key to provide public education about protection from ticks and mosquitoes, and helping people to understand how to do source reduction, such as removing pools of stagnant water. And also their prevention program is also larviciding in the local community. So most communities are providing prevention programs about vector-borne disease. And one of the things that in researching the types of actions that local communities are undertaking, I interviewed experts across Canada in different jurisdictions. And a common theme that I heard was that in order to build a resilient community, partnerships and collaboration are key. And the resilient community should include everybody, local governments, health authorities, communities, and as they're more effective when they're working together to plan and advocate for climate change. And from listening to the speakers throughout the day, it sounds like Grey Bruce Healthy Communities Partnership is really an organization that is being very effective to work together to plan and advocate for climate action. So this presentation provided a really quick overview, because I talk really fast, on local climate action that for the module that I produced for CAPE. And if you'd like to learn more about the types of policies and programs that I discovered, and there's some case studies in it as well, then visit the CAPE site, and it's module 7. I think Ronald's was module 5. He also did a module in the CAPE toolkit. And this is just an acknowledgement of the photos. And what Ronald and I would like to do now is just find out if there's any questions from the people that are in this session, and also to talk a little bit about what local actions there are in Grey Bruce. What type of actions are underway or planned? Are any of the things that I've talked about or Ronald talked about underway, or are you planning them? And if so, what challenges are you facing in promoting climate action? So that's me.
Thank you, Carol. I know we have a lot of folks on the line that represent municipalities, counties, and a lot of our climate change action teams across Grey and Bruce. So I'm thinking there should be some responses to the questions you've posed. So I'll encourage people to either add to the chat or unmute your line, and you can share verbally as well.
Hi, Jason. It's Rob Potter from Blue Mountains, and just a couple of quick things. One is the Grey County Trails and Cycling Plan, which is just come before council. And here in the Blue Mountains, we have our leisure activities master plan process well underway now. We also have our integrated community sustainability plan consultants just getting to work now. At putting together a new plan. We do have the Sustainable Path Plan, which has been around about 10 years. So this will be working to update that.
Yeah, thanks, Rob. That's perfect. I was going to reference the Cycling and Trails Master Plan as well. I think that'll be a great plan for the county and the member municipalities to move the county forward from an active transportation perspective. Reference to the City of Owen Sound is currently undertaking a corporate climate change adaptation plan and a new official plan. So certainly some of those guiding documents will help lead the city forward.
Just out of curiosity, I'm on the Durham Region Climate Change Roundtable, and there's obviously a climate change plan and also an adaptation plan, but how are people feeling about the implementation of their plans? Are they actually able to follow through on your recommendations for moving forward? Are you having to take a step back and reassess? Or are you able to move on everything that you have in your plans?
I can probably just weigh in and speak to the county. I know their plan's still in development, as is my understanding for Owen Sound. So it may be a bit early to even comment on that, but I'll again open the floor for those involved to speak.
If I can just comment a bit, is I do think that oftentimes when it comes to the implementation, there's always the cost side, which that is a barrier to implementing things. So I do think that's where putting in sort of the value of doing these things in terms of the benefits and including the health benefits is a way to encourage people to realize that the cost for these actions is in fact money well spent. So I think that that oftentimes is one of the blocks to implementation.
If I can chime in again, since not too many other people are speaking. When we did the Sustainable Path Plan in the Blue Mountains in 2009, 2010, one of the economists we hired liked to say that economists only know how to add, they don't know how to subtract. And so what they do is they only talk about how much money you can make. They forget about the cost of things. So having a natural disaster is great for your local economy, but not so great for your people. And so what you just said, Ronald, is along that line. Sustainability isn't just about the environment. It's about your local economy. It's about your social and cultural fabric. Our corporate strategic plan, which we just formally ratified recently, is based on our sustainability plan. So that is how we're taking the sustainability path and building it into our corporate strategic plan so that all of our town staff are working on that same page, using the same sort of three legs, if you will, economic, environmental, and cultural, social. So those are the ways that, at least one way that you can start to put the sustainability plan into practice.
So we just have another minute or two if there are any final comments, questions, responses. Feel free to chime in. Otherwise, I have put the links to the subsequent sessions that will follow. So you again have three choices, and I've kind of outlined those in the chat. So you're prepared. We'll have about a 5-minute break between sessions.